It's actually wonderful, but right now you will see, right? But,
So, colleagues, good afternoon. For those of you who are online, we'll start now. The room is being filled here. So, yes, I can see several of the participants who are also online. Can you please confirm if you hear me? And if you see
Yes,
us?
Francesco, we can hear you.
Yes,
And
we
we
can
can
hear
hear
you.
Thank you very much. Okay. Hi. Everything good? I think we're fine. Beautiful. So, colleagues, good afternoon. Welcome. So, Excellencies, colleagues and friends, it's my pleasure to welcome you all to this meeting on integrating essential nutrition actions in universal health coverage. I'm pleased to see you in person during this very busy meeting at the UN General Assembly. We also have colleagues that are connected to the meeting online. My name is Francesco Branca. I'm the director of the Department of Nutrition and Food Safety in WHO, and I'll be your moderator this afternoon. Let me start by saying that malnutrition in all its forms is a significant problem in every country. Nearly 1 in 3 people around the world has at least one form of malnutrition. We can celebrate the reduction of stunting in many countries, but we still see unacceptably high rates of wasting and an uncontrolled epidemic of obesity. Part of the reason for this is that nutrition has not been systematically addressed by our health systems. That is what we are here to talk about and highlight the need for further action. And this is a special year because we are the second meeting of the UN General Assembly on universal health coverage. Today, we have an exciting agenda. With us, we have representatives of Bangladesh, France, Japan, Ghana, Indonesia, UK, as well as UN-Nutrition, AMREF Health Africa, Helen Heller International, and Nutrition International. We're also excited to see the youth representative and human rights activist Pierre Cooke from Healthy Caribbean Coalition, a SUN lead group member. There will be a panel session after statements from the co-sponsors of this meeting, and you'll have the chance to ask questions. So for those who are online, please put your questions on the chat. I really would like to show my gratitude to Bangladesh, France, and Japan for co-sponsoring this event. Before we hear from countries and partners, please allow me to introduce Ashan Khan, the coordinator of the Scaling Up Nutrition Movement, who is co-organizing this event with us today. Mrs. Khan has been an international public servant for over 30 years. Previously, she was the UNICEF Regional Director for Europe and Central Asia, and the Special Coordinator for the Refugee and Migrant Response in Europe. Afshan, over to you for the opening remarks.
So thank you so much, Francesco, and thank you, colleagues. It's really a pleasure to be here to open this side event on the importance of integrating essential nutrition interventions in the universal healthcare coverage. Ahead of the UHC 2030 high-level meeting this week, I am really thrilled to join you, and I want to also extend my heartfelt appreciation to the co-sponsors, Bangladesh, France, and Japan, for supporting the event and for the commitment to make sure health systems continue to contribute to nutritional outcomes. Universal health coverage is part of the social contract that commits to equitable and quality health and nutrition services for all, without financial distress or hardship. And investing in robust, inclusive, and sustainable health and nutrition systems is a catalyst for human capital development and central to many of the SDGs. Chronic undernutrition, overweight and obesity, and micronutrient deficiencies are all issues that we still need to tackle. And we're acutely aware of the impact of inadequate nutrition. It jeopardizes childhood development and leads to health complications in adulthood. It reduces productivity of the labor force, strains health systems, and increases health costs. Including nutrition in universal healthcare initiatives leads to immediate health returns for children and can help prevent malnutrition across the life cycle. Despite its centrality to the SDGs and human capital, nutrition is often missing in policy discussions and lacks adequate funding. Integrating nutrition interventions into universal healthcare is an economic and social imperative that contributes to building resilient societies. I'm really counting on member states in particular to make this very clear in the UHC 2030 high-level meeting later this week. The 2021 Nutrition for Growth Summit in Japan saw stakeholders make significant commitments to invest in nutrition. Yet the financial cost of addressing poor diets and malnutrition have risen due to COVID-19 and the polycrisis. Again, member states, welcome, Chris, and development partners to leverage the upcoming N4G hosted by France as an opportunity to expand commitments. Adopting a preventative approach to malnutrition can be a game changer in many ways. Routine screenings and assessments can preempt several health complications and enable timely interventions, translating into long-term savings in terms of health costs. Overweight and poor diets elevate the risk of NCDs, which causes an estimated 74% of all deaths globally. Over 1 billion adolescent girls and women suffer from undernutrition, deficiencies in essential micronutrients, and anemia being the key factors. So expanding access to nutrition services within universal healthcare is particularly beneficial for adolescent girls and pregnant and lactating women, and contributes to breaking the intergenerational cycle of malnutrition, as many of you know. So what I'm most was struck by, and I think with a great deal of humility since I'm new to this community, is we know what to do. And first, robust data as evidenced in the Lancet and the World Health Organization Essential Nutrition Actions offer a comprehensive suite of cost-effective interventions for maternal and child health. These include a core set of interventions, prenatal vitamins, vitamin A supplementation, promotion of exclusive breastfeeding, complementary foods after weaning, and lipid-based nutritional supplements, as well as treatment of malnutrition. They need to be part of minimum packages of services available as part of the universal healthcare agenda. Secondly, we need progressive financing strategies. Nutrition services are often not explicitly prioritized in universal healthcare budgets. There are opportunities to leverage domestic resources to use or better use existing resources of financing, maximize the ODA flows from health sector budgets, including support from the IFIs, and harness new sources of funding. And then thirdly, I would say, because what gets measured gets done, nutrition indicators must also be incorporated into the universal healthcare tracer indicators, allowing us to track the coverage and quality of essential nutrition actions. Those of you working with the Sun Movement or familiar with its work know that we're committed to a multi-sectoral approach by bringing together under government leadership and often under the Prime Minister or President's office, relevant ministries and stakeholders. Sun countries are taking multi-sectoral approaches to nutrition outcomes. Sun country coordinators work with the ministries of health, agriculture, women and youth, social protection, climate and environment, water and sanitation. And at the heart of the Sun movement is the system strengthening agenda. And universal healthcare is a stellar example of what system strengthening is all about. The Honorable Ministers of Health from Bangladesh and Ghana and the Honorable Deputy Minister from Indonesia, I'm sure will shed light on their experience of integrating nutrition services into universal healthcare benefits that extend beyond health to touch a number of the Sustainable Development Goals. I know we have several distinguished guests and colleagues to share experiences, also on the opportunities that lie ahead. So I'm really excited about being part of the discussion, listening to the debate, learning what we can do together, and moving forward. So thank you, Francesco. With that, I turn to you.
Thank you, Adam, for your remarks, for really highlighting the fact that we do have very clear action points for nutrition universal coverage, but we don't have the visibility and the resources for their implementation at scale. And that's where we need to focus. The declaration of the UHC meeting hopefully will be endorsed, or at least it will be concluded at the end of the meeting, highlights nutrition, and that's something which we didn't have in the first declaration. So that's an important step forward. But now would like to ask the representatives of the countries that are co-sponsoring this event. I see here in the room Ambassador Takeshi Akahori, who is Director General for Global Issue at the Ministry of Foreign Affairs in Tokyo. So I'd like to ask Mr. Akahori to take the floor.
Thank you, Francesco. Good afternoon, everybody. Excellencies, colleagues. My name is Takeshi Akahori. I'm the DG for Global Issues, all the SDGs. I carry this pin badge all the time. And I introduce myself as being in charge of 16.5 of these SDGs. One is peace and security, and some other colleagues deal with peace and security. But half of that is mine as well. So nutrition is vital to human life. That is, of course, the understanding of the Japanese government. At the G7 Hiroshima Summit, which we hosted in May this year, all the G7 leaders and partners stated that, and I quote, "Nutrition is also fundamental from the viewpoint of a human-centered approach, and we highlight the importance of improving access to healthy diets, including through school meal programs," unquote. I won't repeat the numbers, but there are many children who are suffering from stunting as a result of undernutrition. Nutritional deficiency causes about half of the death of children under 5. And at the same time, the number of people who are overweight and obese reaches record levels, both in high-income and resource-limited countries. It is said that approximately 2 billion people in the world suffer from diseases related to their dietary habits, such as diabetes. So in December 2021, Japan had the honor and pleasure to host the Tokyo Nutrition for Growth Summit 2021. At the summit, by the way, it was supposed to be in 2022 like the Tokyo Olympics, but it was postponed because of COVID-19. At the summit, we issued the Tokyo Compact on Global Nutrition for Growth. It was endorsed by more than 210 stakeholders, including governments, international organizations, private sectors, and civil society. It showed the direction for the international society to improve nutrition. More than 180 stakeholders submitted over 390 commitments, and over $27 billion of financial commitment were announced. We were honored that these results exceeded the outcomes of past Nutrition for Growth summits, and I was going to challenge the French to exceed that. Prime Minister Kishida also announced back then that Japan would provide nutrition-related assistance that will amount to over 300 billion yen, or to $2.8 billion, which would also contribute to achieving universal health coverage, a subject here to the Japanese government. Improving nutrition is related not only to the second goal of the 17 Sustainable Development Goals, but also to a wide range of sectors such as health, agriculture, logistics, water, sanitation, hygiene, gender equality, etc. Therefore, advancing initiatives through cooperation between the various sectors can bring us closer toward achieving SDGs as a whole. Based on the principle of human security and in close collaboration with various stakeholders, Japan is determined to make every effort to ensure that no one's health is left behind. And this certainly includes the achievement of universal health coverage and improvement of nutrition worldwide. Today, I look forward to learning from you. Impact on the ground is important. I hope to hear a lot from you on what's happening on the ground so that Japan can contribute better. And I also look forward to meeting all of you in Paris. Thank you.
Thank you very much, Ambassador Takahori. We were privileged to participate in the N4G process, and we have seen how it's actually been producing unprecedented commitments, policy and financial commitments. So definitely it's a challenge to the French colleagues to do even more. And we also would like to recognize the importance of the political declaration of the G7. There's been a continuity. The G7 and the G20 are now more and more considering nutrition as an opportunity, as a topic for global investment. I'd like now I don't think that we have colleagues from Bangladesh online. Can you please confirm? So I have to give you the apologies of His Excellency the Minister Zaid Malek is being called by the Prime Minister. No, I think Asham is you. So we will not be able to hear from him. So we were expecting the delegation from Bangladesh to join us. If they do, we'll give them the floor. And also we were expecting Mr. Guillou, the Director of Sustainable Development from France. So then I suggest that we go into really the bulk of our discussion, and we'll start from really a presentation on an investment case for integrating nutrition services in universal health coverage. And I'd like to introduce Sineke Unema, who is the Executive Secretary of UN-Nutrition. And please, Sineke, floor is yours.
Yes, thank you so much, Francesco. And while we wait for our dear colleagues online to share the screen with my presentation, just a few words of appreciation. So my name indeed is Sineke Unema. And just what is UN Nutrition? UN Nutrition is the coordinating mechanism for nutrition, for better coherence and consistent delivery on the ground. UN Nutrition is the agencies, is WHO, is UNDP, is WFP, etc., etc. So I'm happy, very happy to be here, and a big thanks to UNDP, who's hosting us, but also to WHO, because with WHO and UNDP, we have been able to kind of build this particular investment case, which I'm going to present to you now. Move on, please. So as said, it's so important to have universal health coverage, including the essential nutrition actions. Also, Afshan Khan already alluded to that. But we need to have a little bit more background, a little bit more solid information about it to be able to advocate for it, to be able to invest in it. So hence we did this investment case. So a little bit of context. UNDP and WHO have done quite a few of health investment cases in quite a few in 70 countries, which resulted in over 80 actions, policy actions. But if we look a little bit more specifically, 35 of them looked at the Global Action Plan on NCDs and looked at the investment case there. Also, a few of them were nutrition related, salt reduction initiatives in quite a few countries, among others Ethiopia, nutrition labeling in, for example, Jamaica, but also trans fat elimination. What we want to do extra, in addition, is to look at packages. You know, nutrition is not to be caught in one single intervention. So we were looking now at a package, a powerful combination of several interventions to look at several forms of malnutrition. Next one, please. So, as said, not just a single set of intervention, but really looking at this at a combined set of interventions for several forms of malnutrition. And as we know, and as was said before, the essential nutrition actions are so critical to be able to achieve the World Health Assembly targets for malnutrition, but also looking forward to the nutrition targets in 2030, basically eliminating all forms of malnutrition. And we think with this improved evidence, there is a bigger opportunity to enhance government investments and even maybe investors beyond government. But also, and I think Afshan, you alluded to that, there is not enough visibility for this. And I think this investment case can also provide a powerful tool, an advocacy tool, to show it's not just, and I cannot say not just, that's not kind of me. I wanted to say not just eliminating malnutrition, but also giving you a return on investment. But of course, the child health in itself is important on itself, not just the financial implications. And then also the investment case can support policy decisions. Next one, please. Okay, so what did we do? As said, really, the brain power of UNDP colleagues and WHO colleagues, and we helped a bit as Secretariat to coordinate with a bit of seed investment. What we did is, first of all, we looked at what is the situation. We analyzed the situation to better understand the status and the context of nutrition in a particular country. We picked Bangladesh. So we looked at the prevalence of malnutrition, risk factors for malnutrition, what are key nutrition-related legislations, policies, strategies, what is the governance, what is the financing situation for nutrition, and of course the status of essential nutrition actions in that particular country. Then also we did an economic analysis. So what is the burden, economic burden of malnutrition, of wasting, stunting, obesity, etc., 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 and then analyze the cost and benefits of scaling up a set of essential nutrition actions to be covered in a country. So we looked at short run, 5 years, and then longer run, 15 years. Next one, please. Okay, so there's quite a long list of essential nutrition action. With this exercise, we only looked at the impact of 20. And why we looked at these 20? Because it really had to look at the intervention had to address a disease or a condition directly or indirectly linked to at least one of the 5 forms of malnutrition: wasting, stunting, micronutrient deficiency, obesity, or diet-related NCDs. Another criteria for selection is that data are available on the cost of the intervention, or it can be estimated from the One Health costing module. And then finally, the intervention or policy health impact can be modelized also using the One Health tool. So these criteria were essential for doing this action. Next one. Okay, so instead of looking at individual interventions, we looked at them in a packaged way. And also this shows you from a life cycle approach, from periconceptual phase until the healthy diet. And you can see it goes from fortification to supplementation to breastfeeding promotion, complementary feeding, etc., etc. So we looked at packages as well as certain sets of interventions that really are linked to each other. And next one, please. Then the methodology. So again, we looked at the economic burden of malnutrition in a country. What is the economic burden in a country? It consists of both direct healthcare costs and indirect medical costs. It looks at the loss of earnings due to unfulfilled aggregation potential, but also loss of foregone labor outputs due to premature death, but also morbidity, and loss of productivity due to absenteeism because of morbidity and presenteeism. So lower productivity, even though you are on the work floor. Then that was followed by an estimation of the return on investment of scaling up these essential nutrition actions. So we looked at what is the scaling up pattern, what does it cost, what are the health benefits once you have implemented a certain intervention, what are then the economic benefits because you prevent people from getting sick or even die, and what is then finally the return on investment. So we picked Zimbabwe as a case for various reasons. And this slide shows you that on the left-hand side, there is really the costs and the people dying, the people being sick. And on the other hand, there is the benefits. The right-hand side, there is the benefits. So you can see that we took the example of 15 years, so a prolonged period of investment of 15 years would cost around 472 million, and it would create 4.5 billion US dollars. So the return on investment is quite substantial over this period of time. Also, already after 5 years, each dollar would generate like 4.4, but up to 9.5 after 15 years. So it's substantial. That's the financial part, but we are looking at human people. We are looking at human beings. So apart from the dollar saved, oh, you're most welcome to join the room. I'll just pause for a second to welcome our guests. So apart from the financial returns on investments, we also see 49,000 lives will be saved, as well as 160,000 healthy life years will be gained. So again, it's a return on financial investment, but it's definitely also a return on human health and human lives. I'd like to go to the next slide, just to wrap up and share some conclusions and next steps. So this study, this investment case is quite innovative in the sense that it looks at sets of nutrition interventions, and it looks at quite a prolonged period of time. But it also has its limitations. That's why we are looking at the next steps. Because we looked at the health sector. We are now in the context of universal health coverage, but we know that nutrition is a multi-sectoral issue. So we would love to move from a health system approach to a multi-sector approach, also with these investment cases, to really make it work for food system transformation. Then, as you noticed, we looked at only 20 essential nutrition actions, and that's because we could do the modeling for these essential nutrition actions. However, as we were doing this case, more information has become available, and even the Global Action Plan appendix of the WHO has been updated, and we would really like to continue using those additional essential nutrition actions to also broaden up this investment case and really go for food system transformation. And of course, looking for interested member states to go ahead and use this investment case as a policy tool, as an advocacy tool, and as a tool to help actual investment for nutrition. I'd like to pause here. Francesco, back to you. Not pause, I just finished.
Well, thank you very much, Tineke, for having indicated with concrete examples actually how investing in essential nutrition action is producing an incredible return on that investment. So the money that is we said it's needed would be well spent. So these are concrete examples, and hopefully your analysis will inspire, the second part of our conversation. But before that, let me welcome the Honorable Kwaku Agyemang Manu, who is the Minister of Health of Ghana. Thank you very much for joining us. We know it's an incredibly busy time for you, so thanks for joining. And I also would like to welcome Mr. Christophe Yu, who is the Director of Sustainable Development of the Ministry of Europe. and Foreign Affairs of Government of France. So actually, I'd like to give the opportunity to Mr. Guillou to give some remarks before we go into the panel with also with Minister Agyemang Manu. So, Mr. Guillou, are you ready to do that?
I'm ready. I came very late. I'm sorry. I mean, it was
We can
very
imagine.
challenging
Yeah, absolutely.
for past the checks, security checks. So first of all, thank you very much for this very important and interesting meeting. I have a very few remarks. France is very much involved in nutrition plans. We support SUN. We have a few, I mean, one of our priorities in nutrition is, first of all, to focus on the first 1,000 days of life. We consider that this is very important for the rest of human lives. In addition to that, we will be hosting, after the Olympics next year, a summit, Nutrition for Growth, back to the Olympics. After the Olympics, probably somewhere between the end of 2014, beginning of 2015. We're not sure yet on the date. Before that, we will be hosting at next month, middle of next month, a very important ministerial meeting on food. Les cantines scolaires.
School food.
School feeding. 18 and 19th October. So, I mean, we have a very clear action plan on nutrition. What I could highlight that, for example, on the actions and the programs of our development agency, Agence Française de Développement, whose has focused or consacré 15% of its actions on nutrition. For some Mediterranean countries, Burkina Faso, Cameroon, Laos, Madagascar, Mali, Niger, Central African Republic, and Chad. We have a specific fund program called MUSCOCA that deals with the maternal health, mother and child, and 25% of what we give to MUSCOCA goes to nutrition. So it's also very important, significant. And 50% of our programs in aide alimentaire, food assistance, 50% of our food assistance program goes to nutrition. And the figures are 170 million euros in 2023 against 39 million in 2020. This is just to stress the importance for us, for France, of nutrition in our across the board programs. Well, thank you very much.
Thank you.
Thank you, Mr. Guillou. You just missed the challenge of Ambassador Takehori, who was challenging you to do more than what happened in N4G in Tokyo, which is a difficult task. It's a difficult task,
27 billion,
but you know, from what you're telling us, I mean, there's all the interest and the commitment by the French government to take that challenge, and you know, after all, it's related to the Olympics. So there must be some healthy competition, and we are all happy to have this, to witness this healthy competition and to fuel a little bit this healthy competition.
And I should say also that President Macron, a few weeks ago, when he received the French ambassadors at the end of August, he mentioned that we will be hosting a summit on sustainable development just before the opening of the Olympics.
Very good.
And we have pushed on that for nutrition. So I think there will be a huge focus on nutrition just before the opening of the Olympics.
Wonderful. Good to hear.
We have to work on this, but I think.
Thank you, Mr.
We go
very
for
much,
it,
Mr.
yes.
Guillou.
Nutrition and sport.
And remember, you know, all, this meeting is all recorded, so all these commitments are on paper. But you know, let me now welcome this panel and introduce the panel. We're very privileged to have Honorable Kwaku Agyemang Manu, the Minister of Health of Ghana. We also have online Mr. Pak Amich Alumami, the Deputy Minister for Human Development, Society and Cultural Affairs of the Ministry of National Development Planning of Indonesia. Here we have in the room Chris Carter, the Head of Human Development Department in UK. We have Desta Lakiu, the representative of Amref Health Africa, particularly the Global Partnership Lead for Africa. We have Rolf Clem, the Vice President of Helen Heller International. And we have Mandana Arabi, the Vice President of the Global Technical Services and Chief Technical Advisor of Nutrition International. So the way I'm going to run this panel is I will have first a question for each one of you, and then we'll open up for a general conversation. So let me start with Minister Agyemang Manu. And Minister Manu, could you provide us with some examples of how Ghana has integrated nutrition into universal health coverage and share some of the challenges and opportunities with regard to this integration, including finance and capacity of health workers? The floor is yours, Minister.
Yeah, good afternoon. First of all, I bring you apology from my honorable minister. He attended another meeting, but he has asked me to make his remark at this meeting. I'm Technical Coordination Director at the Ministry of Health. Yeah, so back to the question. Ghana's universal health coverage roadmap for 2020 to 2030 prioritizes nutrition with 6 out of 7 core UNC indicators focusing on it. Health and nutrition services are delivered at the primary healthcare level, ensuring proximity to communities, empowering or including young people to ensure equitable access to nutrition services. Efforts by the Ministry of Health consider various determinants of infant and young children feeding, including sociocultural factors and rapid socioeconomic changes. The essential nutrition actions are an integral component of Ghana healthcare system and are aimed at improving health outcomes and reducing malnutrition-related issues, particularly among vulnerable populations, such as pregnant women and children. It encompasses a range of crucial interventions to promote nutrition and well-being, particularly among pregnant women and children. Essential nutrition intervention include promotion of exclusive breastfeeding, as encouraging and supporting mothers to exclusively breastfeed their infant for the first 6 months of life. Initiatives under this include baby-friendly hospital initiatives, promotion of workplace baby-friendly environment, and enforcement of LI 1667 and maternity protection. We also promote healthy diets and lifestyles to reduce sale of high sugar, salt, and trans fatty acids, promoting household food security wellness clinics. We are also into prevention and treatment of undernutrition, that's the provision of counseling services, supplementary foods and therapy feeding for malnourished children. We are also providing macronutrients to school children, which is well integrated into the school feeding program. We also ensure that pregnant women receive appropriate care during pregnancy, including iron and folic acid supplementation. The challenges that we are trying to resolve, despite all these challenges, including limited staff capacity and the logistical constraints, we continue to face high rates of malnutrition, particularly macronutrient deficiency and severe acute malnutrition. we are witnessing a concerned rise in overweight and obesity among children. The promotion of exclusive breastfeeding faces obstacles such as violation of Ghana's breastfeeding regulation. Nonetheless, we remain resolute to commit to deliver essential nutrition service for our women. So in conclusion, each day without action to address malnutrition, diminishing the growth and prosperity of Ghana. Ending malnutrition is essential for us achieving the Sustainable Development Goal. Integrating nutrition into UAC is vital, especially during the first 1,000 days of child life. Together as a community, we can reduce maternal and childhood mortality, malnutrition rate, and other health-related issues. So on the whole, our health system has been designed that we have school feeding program for the primary schools up to the secondary schools. We have comprehensive program for our maternal and child health systems, but we are still facing challenges of malnutrition and obesity. Across both poles, we are still facing challenges. But government is working hard to make sure we resolve these as we go along. So in our universal health coverage roadmap, nutrition has been well integrated into the system, especially as we also fight non-communicable diseases. Thank you very much.
Thank you. Thank you very much. We really appreciate the comprehensive attitude that Ghana has to really look at multiple forms of malnutrition. Obesity is a challenge for all the world. So clearly we need to find, common approaches, and probably the scale of the response is the solution. So congratulations for even having taken difficult agendas such as the reduction of salt and sugar. But now I'd like to go to Mr. Amich Alumami. Can you hear us, Mr. Alumami from Indonesia? Yes, thank you.
I can hear you.
Yes, wonderful. And thanks for waiting. And what I would like to mention is that Indonesia is moving towards universal health coverage and is started to integrate nutrition services in the health system. So we would like to ask you to share to what extent the government of Indonesia has mobilized resources for nutrition, and what are the strategies to mobilize the necessary resources domestically and in collaboration with other development partners. Mr. Alubami, please.
Yes, thank you very much for the very best opportunity for us. Maybe I just answered the question, and it is very good opportunity for us to share with you. I think we share in common about the issue of the importance of nutrition, and it should be taken with the use of multi-stakeholders and multi-approaches. And I can share what actually the government of Indonesia have done and plan to do for the next futures. Actually, the nutrition issue has been the priority of our national development plan, and we apply what the so-called improving health services toward the universal health coverage. And it is especially we strengthen the primary health care by encouraging promotive and also preventive efforts, supported by the use of technology and also innovation technology for the delivery services. And we also apply the policy direction. We divided into 5 elements, 5 groups. Some of the very important is about how we have to accelerate improvement of community intervention. It includes also nutrition security, provide the clean water and sanitation. And we also agree that the issue of nutrition not only belongs to a certain state agency like the Ministry of Health, but it also belongs to the Ministry of Agriculture, the Family Planning Agency, Ministry of Home Affairs. And that's why we, as a government, should incorporate all the state agencies to deal with the issue of nutrition. And as it's very closely related to the issue of the prevalence of stunting. And food fortification also very important. Nutrition surveillance system is part of our policy direction. And in addition to that, we also have to improve the maternal and child health, family planning, and reproductive health. It covers nutrition for adolescent girls and also pregnant women. And about the strategy that is also become the very challenging task of our government is how to incorporate all the national potential, both at the national level and also at the provincial level. We work together with the local government, both provincial and also district, by allocating budget and also mobilizing all the public resources, including national budget and also regional budget. We classified that mobilizing resources for nutrition action is very important as part of our effort to reduce the stunting prevalence. We can move to the next slide, please. About the coverage of the government funding, we maybe the next slides. I think the one more slide. I think we have ministerial budget and also fiscal transfers and also village funds, and all these three are the public resources that we can mobilize to deal with the nutrition and also stunting prevention reductions. On the part of the ministerial budget, we already have a kind of program as a plan that that are implemented by the Ministry of Health and also Public Works and Housing, and also the Ministry of Agriculture. And it is important also, as we have also the fiscal transfers directly to the regional government, both provincial and also district, to address the target of nutrition intervention, reinforcing the routine data entry and also improving the quality of integrated monitoring evaluation, with the hope that the results of the convergence action to become a reference in planning fiscal transfers locations. And it is important. It is also important for the central government that the district government should allocate budget for stunting from the district budget, and also the district government should also monitor the village fund, how the way they use, the way they spend the money for acceleration of stunting programs. And also the district government should also monitor the use of national budget in their jurisdiction. And the last, we increase the involvement of non-government stakeholders through the SUN networks. Actually, we also identify the state agencies that can contribute to the programs and also intervention. We involve the Ministry of Education, as we have a program food feeding for school children, and also early childhood education, health, agriculture, and also the Ministry of Public Works and Housing in providing clean water and also sanitation and health, and also supplementary foods, family planning campaign tools. And all these things are strategies that we apply in our ministry, also our government at the local levels. And we believe that by incorporating all these stakeholders, we can manage our program and finance and public resources to deal with nutrition and also the incidence of stunting. I think all these things that we have done already and hopefully that it contribute to the stunting reduction and improving the quality of nutrition for Indonesian peoples. That is all that we have, we can share with you all. Thank you.
Thank you very much. I think this is a very clear reply to my question. You have a mechanism to allocate the budget, ministry, to create village funds, but also you have a mechanism to monitor the implementation of the funds. So clear that without a clear system to allocate the resources, those activities will not be implemented. So this is a clear demonstration of what can happen. So thank you very much for sharing with us. Thank you very much for being with us at this very early time in Indonesia. We know it's 4 a.m, so we appreciate your
Okay, no problem. It's good for us to have this very good opportunity.
So I also would like to welcome the delegation of Bangladesh. Thank you for making it. I understand it's been a bit difficult to find us. In particular, let me welcome the head of the delegation, Dr. Mohammed Anwar Hossein Hawla, who is a senior secretary of the Health Services Division of the Ministry of Health and Family Welfare. You're co-sponsoring the event today, so I'd like to give you the opportunity to be part of this panel and give your message around universal health coverage and nutrition before we go to the other components of the panel. Would you like to do that, Dr. Aulader?
Okay, thank you very much. Thank you, ladies and gentlemen. Know that Bangladesh, small country in the world, but it feels this is welcome much. We have small land, but close number of population, 170 million population. And you can say it's the most densely country. So, our challenge is this program, we are running the sector program. And sector program is compliance with these programs, and government is prioritizing this issue. And I know that it's in the independence, the father of the nation, who was emphasis on the nutrition and in the constitution, he elected the provisions so that every people have the right to access to the nutrition properly. So, keeping in mind this constitutional regulation, present government has emphasized the program is running with the Health Services Division as well as the other segments. 22 ministries are working for this program. And Ministry of Health is working in the managing the micronutrient and the other vulnerable people like the child and the school boys. Those are addressed by different ministries, like social welfare ministry, ministry of education, and ministry of food, They are giving the support and they have the pregnant women. The government is giving the 1.25 million women pregnant baby. 1,000 growth for giving the nutritional support. Those pregnant. As well as the people, the women, the women. In this program, another program is the youth development program. More than 1.5 million women in this program. And so the programs are from the Ministry of Health. We are running some programs that includes vitamin A capsule for the child needing this vitamin supplementation and food fortification. In the standards, some awards programs, the recent programs, and after all sorts of actions, we feel that the spending reduced from 36.1% in 2004 to 54%. And the wasting and the wasting has reduced from 8%, from 14% to 8% at the same time, and the has reduced from 33% to 22%. These are the improvements and in this program also, and it is that our availability and and also the power is controlled, the only class people that so that no one can demand for the nutrition. That's why I think that knowledge is very that, but it requires huge amount of money. We need for which our program was this time. We have rules package, the incentive package for the school, so that the people will not have to feel the hardship of the food, and after for which the war economy is seriously disrupted, because most of the things we have to import from countries like oil and some other items of energy. So the government is under very pressure, but there is a good thing that she is committed, and she does not compromise even health. It's very approach anybody or any program to her, and she is willing to support everyone. So I think this is in a nutshell. Thank you.
Thank you very much. Clearly, you have reminded us the importance not just to deal with that, but to deal with the nutrition issue in the context of the engagement of multiple sectors. And we also appreciate the priorities that you have given to women. I'd like to remind everybody that Bangladesh has received an award from WHO in 2015 for having reduced maternal mortality and child mortality. I remember the number of child mortality by 64% in the period 1990-2015. So that's a remarkable achievement, and we see that the continuous commitment on improvement of nutrition is clearly a priority for national development. So thank you for that. So let me now continue with the panel, but talking about engaging the development partners. So we've heard from the countries, the successes, the experience, the challenges that are still there. So let me turn to Chris Carter. We need to ensure that nutrition services are accessible to all. How can we increase the coverage of essential nutrition action through the health system with a focus of reaching the most vulnerable? What you see the challenges and the opportunities to reach this goal? Chris.
Yeah, thank you, Francesco. Thank you for letting me dry off before speaking about it. And it's really great to hear progress from the countries that we've heard on. It's really remarkable. Prevention and treatment of malnutrition is top priority for the UK government, and it has been for a long time. It's a core focus of our work on global health, humanitarian response, support of UK goals on women and girls, climate, and it's central to our efforts. We made it central to our efforts to end the preventable deaths of mothers, babies, and children. But my first point is that it needs to be a priority of every country, whether you're a donor country or a partner country. And that's one of the first challenges. It's not always a top priority in the way it should be. Ensuring everyone has access to nutrition services, it's fundamental. And we need to especially focus on the most vulnerable, because this food security and nutrition crisis that we're in is hitting the most vulnerable hardest. And I'm talking about children under 5. I think we're all well aware of the number of children with severe wasting in the worst affected countries actually increasing. We're in 2023 and it's increasing rapidly. And that's a huge concern for the UK. I'm sure it's a huge concern for all of us. But my second point is that it is often solely seen as a humanitarian issue. It is a humanitarian issue, but 3/4 of wasting cases are found outside of humanitarian situations. It's not only humanitarian. We know that globally, only 1 out of 3 children in need have access to treatment. 1 in 3 children. So what is going so badly wrong? The problem, when we've talked about this, and the presentation was great, by the way, is that there is no silver bullet. We know, though, that efforts to prevent wasting, to build strong health systems, to integrate nutrition, as well as deliver effective humanitarian responses, they're all equally important. So health systems have to play a central role, right? When we talk about universal health coverage, my department is on universal coverage as well, we have to talk about it at the same time. The health system, and especially primary healthcare, is essential, plays a central role for delivering high impact, cost-effective nutrition interventions at scale. In fact, it's the only way. Currently, coverage of nutrition services in healthcare lags way behind traditional health interventions. So we believe a critical step is to integrate nutrition interventions into costed basic packages of health services delivered by the health system, and to ensure that these are properly financed and, as we've heard, properly monitored. And this can only be achieved through joint action. Obviously, we can't just focus on the health sector alone. So the UK is working alongside many organisations and governments here today, I think all the governments here today, to make wasting treatment available to all who need it as part of our effort to end the preventable deaths of mothers and babies. In 2021, the UK launched the Nutrition Match Fund to treat millions of children suffering from wasting and work on prevention. The fund has so far raised over 12 million from partner governments and donors, and partner governments as well. But there is much more that we can do to increase access to malnutrition services. We need to continue to work across sectors, another challenge, to achieve our nutrition objectives. And it needs to be a collective effort. You hear me say that a lot, and I won't talk too much on that. We've been working closely with the Sun Donor Network on some of these priorities, and we're really keen to engage as widely as possible. So, in November, the UK will host a global food security nutrition event in London to increase action on hunger and malnutrition. This will bring together global leaders and experts in nutrition, science and research, climate resilient agriculture, and humanitarian agencies, and WHO will play a key role. It will help us work more closely together. That's our ambition. Highlight the interconnected nature of the challenge, a wide range of stakeholders coming, and it will galvanize action. And at the event, we will inaugurate the Child Nutrition Fund. Some of you may know about it. It's co-funded, the Gates Foundation and the Child Investment Fund Foundation who are working with us on the event and funding with us. We hope this will lead to a more effective, affordable way to tackle child wasting and actually get donors all together. So as well as get donors together, it will focus on increasing domestic resources to programs and essential supplies beyond humanitarian response, and ensure many more children have access to essential nutrition services. Say a lot more, but I won't. I'll hand back to you.
Thank you. Thank you. I'm really happy to hear about this important commitment for November. As you know, WHO has released guidelines for the management of obesity. We have also now guidelines for the prevention of obesity, so we'll be able to share with you, basically how to make good use of that money. So, but now let me ask Vandana to tell us how Nutrition International can advocate for countries where you operate to pursue a comprehensive approach to nutrition and universal coverage.
Thank you very much. It's really an honor to be here today. I'm working for Nutrition International. It's a nonprofit international organization. We have focus in 10 countries, and we have been really focusing on high-impact, low-cost nutrition interventions for more than 30 years now, with support from the government of Canada and other partners. So, first of all, I want to add my voice to what has been mentioned and reiterated many times in this room today. Nutrition is foundational to health and to the universal health care. We see this as the basis for good health, for immune systems to be able to actually respond to illnesses and to really allow an opportunity to everybody to have the best chances at a healthy and productive life. So in that sense, we feel that we really have to do better in terms of achieving a balance between focus on treatment and the cost of those treatments for many illnesses and diseases on the health systems nowadays, and what prevention can do for us. It's always generally, harder to convince making these investments early on, years in advance, and really convincing the governments that those investments will pay off. So being able to make that case for all these essential nutrition actions would be really important, and to really have that balance between preventive and treatment services. It was great to see that the investment case that was presented earlier, for example, has this balance, and that would be the same approach that we would have. Again, I think it's important for the nutrition community to speak with one voice, also talking about what these priorities are, what are some of these key actions, how the countries can actually go about identifying what works in those settings, and then financing them and prioritizing them, hopefully for interventions, for implementation. Another approach that I think is really with the advancement of the whole international nutrition field needed, and especially with the current challenges, would be to not only talk about for single interventions that affect certain conditions, but not to talk about double and multiple wins that some of these interventions can give us. Some examples, for example, you can focus on taxation on sugar-sweetened beverages and the fact that those in itself, of course, as an intervention can reduce the non-communicable diseases and improve the nutrition as an immediate outcome. But you can also channel the revenues from those taxation policies into better health and nutrition interventions for mothers and children. And that would affect not only the same generation, but really in future generations in reduction of malnutrition, in also reduction of non-communicable diseases, even in the following generation. So these are the kind of prevention actions that can have multiple wins over the course of time. And I think we should do a better job of investing in those. I would even say that the evidence shows us, even beyond nutrition and non-communicable gains, we could have gains in, even addressing again, better immunity and tolerance against key infectious diseases. Now evidence is emerging that, if you can have good nutrition programs in place, even transmission of tuberculosis can significantly be reducing community. So being able to make those cases also beyond the nutrition community, that these interventions can actually help us achieve other goals across the Millennium Development Goals, other goals in the health system will also be important. I want to say that we have to also focus better on what countries need and provide some of those tools and services that help. For my organization, some of the things that we have found really helpful. One would be to help with data for decision making. Again, earlier it was mentioned how data is important. I would say not only the data itself, having good, really real-time, relevant data, but also helping governments and countries to also analyze that data, make that data useful, accessible, and ready for decision-making. So, for example, investing in tools that allow for decision-making processes to be quickly done. And Nutrition International has developed a tool called Cost of Inaction. So this is a tool that allows you, for example, to identify what are the costs of not investing in key nutrition, essential nutrition actions, and to be able to actually make a good advocacy package based on that and work with the government. Similarly, providing technical assistance on an ongoing basis would really be something that could have long-term gains for all of us. And all in all, I would just conclude. I think we are really nutrition is an essential part of the universal healthcare and the UHC, and I think we should try to really make the case that these key interventions in nutrition, UHC, reduction of NCDs, they're all part of the package of being pro-universal healthcare, pro these essential needs of humanity to be able to really address the challenges of today. And again, coming with a unified voice to places like this room to be able to actually support each other in that area. So thanks, Mr. Chair, and thanks for.
Let's ask the same question to all. How is Helen Keller implementing essential nutrition action? In fact, I think this is this term we owe it to Helen Keller International, because you were the ones who first developed this idea. Then we took it and you generously donated to the international community.
Thanks, Francesco, and just wanted to thank the co-sponsors, France, Tokyo, and Bangladesh, where Helen Keller is also operating. So I think first and foremost, our approach is firmly, as the nutrition and essential actions, firmly based in a solid evidence base. And one of the key takeaways from the Lancet series on nutrition in 2021 is really the unfortunate neglect of these life-saving interventions within the healthcare system. And one of the effective and most quickest ways, to improve the reach and quality of these interventions is to scale it up in the health system. Nutrition can be complex to policymakers, and I think our focus needs to be to bring clarity and to prioritize the most impactful solutions. So as an organization, Helen Keller has really focused on this continuum of care and focusing on 5: prenatal vitamins, optimal breastfeeding, twice annual vitamin A supplementation, enriching children's diets starting at 6 months, including the provision of small quantity lipid nutrient supplements in appropriate contexts, and the early detection and treatment of acute malnutrition. You can't do it all, but if you can do those things well and get high coverage, you've made enormous inroads. The gap, though, between the delivery of these and the coverage of these services and what the healthcare system offers in other services is huge. And I think of this as what's called a voltage drop, where despite women and children using the platforms of health delivery, the kinds of services, nutrition services, really lag behind. And so, for example, if you take something as fundamental in pregnancy as the delivery of prenatal vitamins or iron folic acid, right now, about 50% on average in low-income countries take advantage of antenatal care services. But just a little over half of that gets the 90 minimum of 90 iron and folic acid tablets. This is a missed opportunity and low-hanging fruit. So I think that that's really got to be a focus. In Sierra Leone, for example, we're working on helping the government transition from iron and folic acid to the use of multiple micronutrient supplements, which we know have superior benefits. And the opportunity is quite great because 90% of women actually show up for 4 prenatal visits, but only 30% consume the minimum of 90 recommended iron and folic acid tablets. So we're looking at this transition sort of to galvanize taking this very seriously. Our chief of programs, Sean Baker, who many of you know, kind of characterizes that the delivery of these nutrition interventions should be seen as a marker and a maker of quality healthcare. So I think that's pretty key. One of the most exciting developments on our radar right now is the growing understanding of country-level opportunity gaps in the health system and how we can supercharge our efforts. So just let me give you an example from our vitamin A supplementation program in Africa, where we work hand in hand with ministries of health partners. Just in the past 6 months, the first semester from January to June, we reached an astounding 35 million children aged 6 to 59 months. But what's especially thrilling about this is we then do coverage surveys. And we have just launched modules which will get more or less real-time data on the coverage of these interventions, which is often lacking in things as fundamental as the demographic and health surveys. For example, who gets counseled, who gets measured. So I think that's going to be really helping us to really supercharge those interventions and share those interventions. Let me finish by saying one of our priorities, foremost priorities, really involves getting the services closer to the people who need it. And I just returned from Nepal, from a truly inspiring visit, where the cornerstone of delivering essential nutrition services has long been the dedicated cadre of female community volunteers. And through our work with the USAID-funded Suahara program, where we've collaborated closely with both the government and civil society, we've really seen bolstering of the action of really these female heroes. So, and the results speak volumes. The country's consistently maintained an impressive 90% coverage of vitamin A supplementation, and it's been breaking records in delivering iron and folic acid supplementation to pregnant women, with over 70% consuming at least the 90 tablets. So let me sort of finish by saying our experience, along with that of our partners, leaves no doubt. Achieving widespread impact is entirely feasible with 1, the right focus, 2, the right capacity, and 3, the financial backing. What's crucial now is to meticulously document and, in my view, celebrate the successes we've heard from Ghana, from Bangladesh, and other places, all while positioning these key essential actions as really a golden opportunity for the health system to fulfill its mandate of saving and transforming lives. Again, making it the integration and the quality and reach as markers and makers of what defines a quality health, universal quality health delivery system.
Thank you, Mark, for all these achievements, really. And as I said before, the list of priorities also to the work of Helen Keller. But you highlighted an important point, which is the gap of the implementation, which might also be related to the lack of demand. And I'd like to ask this last question to Desta. What do you think can community demand generation, how can we do that? I mean, is it something that we do through information? What's your experience? What can you share with us?
Thank you so much. Let me first start by saying, AMREF works with the community and also with the government. So we are in a very unique position to see what the government efforts are and what the community needs are. And I think we all know that the underlying causes of nutrition are multiple. And there are different types of solutions or different types of interventions for them, which we're involved in. So there's not one thing alone that we address in terms of food security. So we look at the entire environment and we work very closely on 3 levels. One, we work directly with the communities. And in working with the communities, we actually do workshops, community engagement, outreaches, really on the ground empowerment of communities. And so we work very closely with them. We do education materials. We look at non-traditional spaces such as the education system. We look at, we even use apps. We use mobile applications. For example, in Kenya, we have a mobile app called Lucy app. And that really empowers families and pregnant mothers to look at nutrition for the first 1,000 days. I think earlier someone mentioned that. So we do quite a bit of community engagement participation. That actually knowledge drives action. For communities to understand and know, that drives action and interest and uptake of whatever services that we're offering. So some of the services are not, are things like improving breastfeeding. So in some of the programs that we have done in Kenya, for example, we have seen actually a 33% increase in breastfeeding by mothers. And that's largely because of the community outreach. We have seen, 2 times increase in vitamin A supplementation uptake because of the community outreach that we do. But how do we get that community outreach? So we work now at another level, a little higher level. And that higher level is looking at making sure that the community health workers or the health workers are appropriately trained and equipped to be able to also generate demand. So there is immediate, a direct engagement with community. Then there's engagement with health workers at every level to ensure that they are equipped with the right information, to ensure that they're able to provide intervention at the community level. So really looking at building health community. So capacity building, knowledge and skills, again, because we recognize that these communities are far, we are in 35 countries, I believe, 35 countries in Africa, so they're remote communities. So we want to make sure that we have tools that enable learning for health workers, and those tools are mobile apps, essentially making training and education available to them when they need it and when they're able to access it. So really looking at training and capacity building, that's the second level, it's the health worker level. The third level is really looking at government engagement. And again, we work between government, ministries of health, and community. So that government engagement really looks at focusing on engaging government so they prioritize nutrition. So that's the type of engagement we do. And what we try to do is really look at how do we operationalize some of these levers, and that might be policy frameworks, or that might be pushing for additional investments in nutrition at country level. Nutrition and those type of interventions have to be country-led. It's not something that we can do on a global level. We can provide the frameworks and the systems, and WHO can do this and that. But the bottom line is it has to be country-led. Countries have to decide the investment is worthwhile, and we need to make sure they understand why it is worthwhile. So I think that really improves uptake also of governments to take commitment and ensure that they are able to push this. So to ensure nutrition intervention is integrated into the national health systems. So that's now the third area of accountability. Now, what we've done is in empowering the communities, we have also ensured that we've developed accountability scorecards so that the community now has, so we all know that we talked about ENAs earlier. That's how we talked about ENAs. So how does the community engage with the ENA? And in our case, for example, we have developed accountability scorecards, working very closely with national and subnational government bodies. And this introduces an accountability mechanism that you typically won't find. And it gives an opportunity for the community also to keep their leaders accountable for the promises that they are making. So really making sure that not only are you collecting data, but also the community is able now to challenge and to say, where's the promise that you made me? So that is the mechanism that we use, but really we're driving uptake of services. We are using mobile applications that are accessible to people. Our Lucy app, for example, is bilingual, so it's English and Kiswahili, so that women who are pregnant can access it in multiple languages, local languages. So those are the kind of things that we do at the country level. We also operate on a regional level. So regionally, as I said earlier, this has to be country-led, but sometimes countries can learn from other countries. So we have very strong convening capabilities, which we leverage. In the past couple of years, we have done South-South collaboration, looking at countries that are exemplar countries that have improved. For example, Ethiopia, Senegal, they are exemplar countries, and then bringing two other countries and making sure those countries have an opportunity to engage and learn from one another. And that has been really very successful for us as well. And then most importantly, I think not only driving local and community interest and the need, but also ensuring at the government level, they have the capabilities and the support. So providing technical assistance for governments has been a way to also drive interest on the government level.
Thank you, Dexter. So this brings us to the end of the panel. Before we end the whole event, we have two more important voices, but I'd like to basically summarize this panel by saying that we've really focused on the word investment that we've seen by countries. It's there. It's done by development partners. It has a good return on investment. An investment on priorities that should be country-led, science-based, and for quality services. And that's where we're going to have a demand. But now I'd like to give the floor to Pierre Cooke, who is from Barbados, is a human rights advocate, is a former Prime Minister of the Barbados Youth Parliament, and is the member of the Sun Leader Group member. And really, the question to him is, how about the youth? How can the youth drive this change?
Yeah, thank you very much. And I do want to say thank you for having me as part of this conversation and having young persons to be a part of this conversation. I'll start with a story. Just last night, I was out with the Prime Minister, me and Motley. We were running around trying to find food in New York, and it was a bit difficult. When we finally found something, it was a diner, a 24-hour diner, really crusty food, really bad shrimp, bad fries. And she sat there and she was talking to us, and she randomly looked over and she was like, "Hey, Pierre, how are you doing?" I said, "I'm good." She was like, "Are you ready to take over?" And I said, "What do you mean?" She said, "We want you to get involved in politics. We want you to get involved in leading the charge for the future." And I share that story to say that youth really are the driving force of what we want to see in the future. And so it's important that we start that engagement with young persons now. Because if we have global leaders who are seeing potential in young persons and mentoring them and deciding that this is the future, we want to invest in this, I think we necessarily want to partner with young people so they understand the value of a nutrition-focused message, so that we ensure that in years to come, we secure the future of moral, strategic, political leadership from our young persons. So necessarily, I'm here in gaining this experience, knowledge, and capacity about the importance of investment in nutrition. And this is information I can take back to the Prime Minister, the Minister of Health, and have that conversation continue at a national governmental level. That is a strategic partnership that you may not have had if I wasn't in the room. That's a strategic partnership you would not have had if the Caribbean was not represented on the Sun League Group movement. One of the things I think is most valuable about this gathering and the body of persons that we have is the marriage or relationship between civil society organizations and governmental organizations or individuals. Because now I'm able to understand the importance of investment and financing in nutrition as much as the importance of civil society organizations raising a moral, strategic conversation about it. Now, youth. We often talk about young persons and why young persons need to be involved in conversations around nutrition, food security, and health as just a buzzword. I think for the last couple of years within the health space, we've been trying to find our Greta Thunberg to take our message at the highest level. I say that within the nutrition and health space, we don't create enough opportunities for young persons to speak at high-level meetings. That needs to happen. How many times have you seen at the UN General Assembly, even at the actual General Assembly, those focus meetings with heads of government, a young person stepping up to that stage who's focused on speaking on health and nutrition? Climate change has reached and received that traction. Health and nutrition has not. Why? Because governments need to understand the importance of that investment in nutrition. And the only way we can get that message out there is to have young persons at the helm of these conversations. So I ask you, we're talking about nutrition for growth in 2024. We're talking about the Hague Summit in October. We're talking about the Micronutrient Forum. We're talking about all these organizations and meetings, these high-level meetings. How many of them have young persons there? You know, when you look at your panel, when you look at the organization of who are the keynote speakers, who are opening, who are closing, who are giving actual speeches and not just responding to, you know, single questions, how many of them are young persons with strong voices from rural backgrounds, from small island developing states? That is what we need. The movement with climate change, I think, came when we had that young girl step out of school and decide, you know what, education is important to me, but my health is important, my climate is important, and I will sacrifice my education for as long as it takes, because I can have an education, but if there's no world for me to live in, it's useless. And necessarily when we speak about human rights and the protection of the right to health, the right to nutrition, we need to have a conversation about how that encompasses and intersects with other human rights. Education. When we found traction in Barbados on nutrition, it was through the Ministry of Education. And so it's important to understand those strategic partnerships between governments as well. In the Caribbean, I've worked very hard to build a cadre of young persons, youth advocates. They're part of an organization called Healthy Caribbean Youth. And across that body of 19 million plus persons in CARICOM, we've managed to train individuals to develop their capacity to speak about health security, food and nutrition security, and why governments need to pay attention to it. Those young persons have been able to lead those call to actions to the highest level. We've had our youth advocates that we've trained through the training I've received speak to ministers of health, first ladies, prime ministers, presidents of governments. We've presented call to actions to them that they have signed into policy. That is traction that was moved and led by young persons. And so what I'm calling for today, and what I'm saying to all of you here, and thanks for the support again of having young persons as part of the conversation now, is that I want you to think strategically about how you can ensure there's investment in the development of the capacity of young persons to lead this nutrition message. That is the face that we want to see out there. That is the face that we want to see carry the message. That impassionate plea that I'm not just speaking about this from a dollar and cents perspective, but this is my reality. You know, when I stand up and I say that the decisions made this week at the UN General Assembly, I leave tomorrow. I'm not going to be in those discussions. But those decisions will have a significant impact on my future. Those decisions will have a significant impact on the future of my children. And so I think it's unfair, I think it's unethical that I'm not a part of that discussion, or someone like me is not a part of the discussion for the rest of the week. Because you are creating a future for me, and I'm not a part of that discussion. That seems weird. How would you feel to be living in a house where someone is changing your windows and doors and taking off knobs and changing things around, and they're not telling you what's happening, but you just have to live with it? It's uncomfortable. It's frustrating, and that's how young persons feel. And that is the energy and passion that I want, and I think would be useful for us to drive this nutrition message. So necessarily going forward, I want us to think strategically about how we can build the capacity of young persons. And the final point I want to say is, through our advocacy in the Caribbean, it's been led by civil society organizations. Hardly has there been a stance where government has said, we will step forward and take the charge on nutrition security. Hardly has there been an opportunity where government has said, we understand the importance of nutrition and of our own volition, we will lead that cause. More often than not, it's been civil society organizations. More often than not, it's been young persons. When we got the national school nutrition policy implemented in Barbados, that action was led by young people. All we did was provide them with the information. We provided young persons in Barbados with the information about sugar-sweetened beverages and how they can affect your health. We provided them with information about their right to health and the fact that their governments have committed to protecting their rights to health, which means that they have to ensure that within their schools, they're not exposed to predatory marketing. And I was in the UK given a conversation to an organization to help them develop meaningful engagement. And I heard about a secondary school where the students of their own volition, just because we provided them with that information, took to the streets with placards and said to the government, we need better. All we did was give them the information. I want us to think about that because across civil society organizations, across small island developing states, across developing countries, if we put those tools in the hands of young persons, they can help to lead and take that charge forward. Now, I'm able to sit and speak and say things that some of you may not be able to because of the capacity you're in. So because you may be ambassadorial or diplomatic, there's certain things you're not able to say because it might be against what the government policy is. Young persons don't have that restriction. I'm going forward and I'm speaking from my heart because this is my future. I can sit and stand or be here today and speak about the fact that government needs to do more because it is my future. There's no political tie. I'm not beholden to anyone. I'm not going to have to report to someone about something I said off key today because I'm speaking on behalf of young persons. I'm speaking to secure the future of myself and my other peers. Investment finances is something that I think we would benefit from in the Caribbean in terms of developing our capacity and understanding of it. Just this discussion today, I have gained tremendous knowledge about how to frame that conversation around investment in nutrition. One of the things I would like to do is to create a proposal to present to our Minister of Health in Barbados about making the case for investment in nutrition based on what I've learned today. Obviously, I'll need some of the information and statistics so I can present the data, but I also would like to be able to present that proposal to the CARICOM group that is focused on the health of the region. And so being able to say to them, well, hey, based on the information I've received from Rolf Clem, based on the information I've received from France and Japan and Bangladesh, here's what I'm saying we can do in Barbados and in CARICOM to increase and improve the profile of health in the region. We have dedicated information. We have resources to show you that this would be the outcome. This is the cost effect benefit. When sugar-sweetened beverage taxation was implemented in Barbados, the government only got comfortable with it because they can say to people, well, if we get the taxes from here, we can put it back into health. So we can develop the accident and emergency sector. We can ensure you have access to food. We can ensure that mothers have access to nutrition. And so when they framed the conversation that way, when we were able to convince the government, well, hey, sugar-sweetened beverages taxes is a good thing. You know, it's a good thing. It helps the people. It helps them to make better choices. When we also inform the citizens that a tax is not necessarily punitive, but it's to help you. And that is the role of government. What else is government to do but to ensure that their people are protected? And so I want us to continue to have that conversation even beyond this week, even beyond this meeting about dedicated investment in the development of capacity of young persons and ensuring that young persons are always a part of the discourse at high-level meetings.
Pierre, thank you very much. So far, a call to action, but also a commitment. We know that Barbados has had this role of leading, for example, in the NCD space, a big movement. But let me ask now my boss, the Assistant Director General of the Division of Healthcare Population in WHO, to give us her thoughts about all this. And I actually hope that she'll be convinced after this that really also WHO needs to invest more in nutrition.
Okay, and thank you very much. My real boss is here. I tried to convince him to not deliver a long speech, and finally you agree, right? Because it's a big challenge to have a long talk after such a wonderful remark. So I still would like to start, dear Excellencies and colleagues and friends. I'm very pleased to be here to close this very important event that just happening before the high-level meeting on the universal health coverage. So I do have a very nice remark, but many of them I'm listening carefully already mentioned by some of you. So if we have time, I may repeat, but I think we can keep for the future. So let me just summarize 3 things. The first one, huge thanks to you all. I am very impressed when I'm listening to you. And thank you very much for your sharing of your good experience and good progress, challenges, and thoughtful reflection. And more importantly, I'm so happy to see a lot of commitment from today's discussion. And second thought is really my personal worry, and I hope you share. I think the world is really in the wrong direction for many, many, many things. And how we can turn this direction into the right things for the future generation, as we mentioned, including nutrition. There are many examples. I just want to highlight amazingly, after so many years, you are right, WHO also should be working very hard. Only 23 countries are able to meet WHO recommended the number of the nutrition professions. So it's really small. And in 48 countries for which we have data, which means majority countries don't have even data. For those small number of countries for which we have data, the average government expenditure for nutrition-specific intervention is less than $2. It's really the lowest among all the diseases category. And the donor investment is also the lowest, less than almost only $1 per person. So it's really tiny. We talk about nutrition, human right. We talk about nutrition for the human capital development and for the economic growth. So it's really amazingly that we have problem. But good news is today we have heard a lot of positive energy. That's very encouraging. I don't need to repeat. So my third point is in conclusion is obviously no universal health coverage without good nutrition. I hope we all can speak loudly during this week, but also beyond. And the WHO, I will commit, and together we are looking forward to working with you all to continue make quality nutrition services access to all, and of course back to our notion, leave no one behind. We need to pay attention to protect those most vulnerable. So thank you very much, and I really appreciate your patience. And at the end of a long day, and also the very important section. Thank you very much. I wish everyone have a good nutrition. For the healthy food. Thank you.